Well, you know, when a woman is hit with the diagnosis of breast cancer, it is like a slap in the face.
I went for a biopsy and was very surprised when I got the results and they said it was cancerous. I didn't think it could happen to me.
Luckily, women that have early breast cancer have the most choices, and the tried and true, and what we treated everyone with historically, is 6 weeks of radiation therapy. That consisted of 5 weeks of radiation therapy to the entire breast, and then the last week we would narrow down just to where the tumor used to be. It's called a boost, and deliver an additional 5 days of radiation therapy. Certainly, partial breast is the treatment that women are the least aware of. People haven't heard about it oftentimes. They don't know that it's an option to treat just that part of the breast that's the most likely to have a recurrence, that it's much shorter, a 5-day option, that she can have brachytherapy, say, where the radiation is from the inside out rather than from the outside in.
The only choice I thought of would be, do you have a single mastectomy or a double mastectomy? And that was my frame of mind going into my appointment. And so I was pleased and surprised when my doctor said that I would be able to have a lumpectomy, and that the survival rate for a lumpectomy was the same as having a mastectomy. And I know it depends on the spread and severity of the cancer, but I think a lot of doctors automatically do a mastectomy when some of the time a lumpectomy would be sufficient.
These days, women need to know that mastectomy is not the be-all and the end-all. And in fact, the survival rates with mastectomy are no better than a lumpectomy as long as you follow that with radiation therapy. So more and more women are choosing to keep their breast rather than lose their breast. And it's a myth that the more cutting, the higher the cure rate.
Women need to know that they will have options. They need to empower themselves with the knowledge that they have choices. Most importantly is, what is my recurrence rate if I do this treatment, radiation in this instance, and if I don't do that treatment? And then what are my options for treatment? And what are the side effects? Side effects both during treatment and side effects that can be long-lasting. And how will it be incorporated into my life now? How will I adjust my life to get the treatment during the treatment? And those are all very important choices that a woman has to make so that the treatment fits her desires, her lifestyle, and her long-term outcome.